Hello guys, welcome back to my YouTube channel. If you're a new subscriber, thank you for finding out this page. All my page talks about is Brazil, how to relocate to Brazil, students in Brazil, life in Brazil, affordable Brazil, general things about Brazil. Welcome my old subscriber too. I love you guys so much. Thank you for subscribing. Thank you for taking me to these 400 subscribers. You guys are amazing. Let's make it to 500. I know you guys can do it. That's why you guys are powerful. I know. So on today's episode, I will be talking about healthcare in Brazil, the healthcare system in Brazil. If you've watched my previous video that I uploaded this morning, you see that I made a video about when I went to the healthcare center. I videoed around, I videoed the nurses, I videoed when I was taking a shot. Yeah, because we had so much flu in the house, so we wanted to take a shot so that it could stop, because I don't know where the allergies coming from and all those funny things. So we went for a shot at the healthcare center. We didn't pay a dime, we didn't pay shishi to anybody. So if you're interested in all things Brazil, how to relocate to Brazil, welcome to my YouTube channel. Kindly subscribe, kindly turn on notification, and kindly share my videos. Thank you. Promises to be exciting. So let's get right into the video. Thank you guys. If you were on my Instagram yesterday and you watched the live with Dr. Tosin, I appreciate you so much. You didn't fall my hand. Thank you for coming through for me. Thank you for joining the live. I really had fun. It was my first live, and I had really nice impression. I am very grateful to you and everybody that watched and shared and asked questions, and welcome Dr. Tosin warmly. You guys are blessed. Thank you. So I'm going to recap briefly. On the live yesterday, we asked Dr. Tosin about his personal life, and he was able to tell us about how he was a student in Brazil and he currently works in Brazil, and he's still doing his, I think he said, his residency. So we know that he's a doctor, a surgical doctor at that. So we know that he studied here in Brazil. We know that he's Nigerian. He was born there. So that was evidence that you can come from your own country or another country entirely to Brazil to school and to practice medicine. No limitation, no racism. Maybe a little if you want to focus on it, but if you want to focus your energy on the positivity, then I would say no racism, because I feel like Africans, nobody can bully us, especially Nigerians. I know you guys very well. Nobody can bully you guys. So, anyways, um, the recap, as we all know, that healthcare system in Brazil, the one that they call SUS, is like the biggest public funded healthcare system in the entire world. SUS, Sistema Único de Saúde, or the Saúde in Brazil. They call it SUS. SUS is the acrimony. So we all know that it's one of the biggest public funded healthcare system in the world, and it has the largest beneficiaries. Like 90% of Brazilians benefit from this healthcare system. So it's not just like it's kind of small program they just started yesterday, that maybe they just started yesterday, and or let me start saying yesterday, it's like in Nigerian slang, maybe like a thing that they just started last week. Like a thing they just started recently, like maybe 2 years, 3 years ago, and then maybe they're just testing it to see if it's going to work. No, this SUS system has been here for over like 80 years now, like 1980 something, 19, let me see, can I remember? I can't remember, but it will be on the screen. I'll add it to the screen. So 90 go. It has been working for Brazilians. Many people have benefited from it, and are still benefiting from it. Like me and my family were benefiting from it. It doesn't make any sense if you come here as a Brazilian and you're looking for health insurance or going for private hospitals. Well, unless you have the money though. So let me not discourage you. Unless you have the money, you want to pay healthcare people, like you want to pay private hospitals, you want to feel like a king, you don't want your time delayed, then you can opt for private hospital. So I wouldn't discourage anyone. If you have the money, you can go for it. So on today's episode, we'll be talking about general healthcare in Brazil, you guys. Healthcare in Brazil. Briefly, I'll tell you guys about healthcare in Brazil. I'm trying to recap everything that Dr. Tosin told us yesterday. So I have my book here in front of me. So if you see me diverting my eyes, I'm trying to stay in lane, not to leave the main purpose of this video. So we started with healthcare. I'm going to tell you briefly about the healthcare in Brazil. So the SUS healthcare in Brazil was founded by the Brazilian government in like many years ago, like almost 60, 70 years ago. So it's a kind of healthcare system that allows the public, general public, to enjoy free healthcare no matter what. Free healthcare no matter the disease, no matter the condition, no matter what hypertension, diabetes, no matter what it is, to enjoy free healthcare in Brazil. So that's what SUS is. That's the general healthcare in Brazil. But you should know that it's divided into two. There's private healthcare and there's public healthcare. The public healthcare, obviously, as the name implies, is sponsored by the government. One way or the other, everybody is paying for it. But how would I explain that you guys understand? One way or the other, people are like, one way or the other, individuals are paying. We are all sponsors of this free healthcare. So maybe like in your task, in your donation, in your payment for something that is not necessary, you've indirectly paid or directed that money to SUS to continue to fund public healthcare. Do you get? But then don't get me wrong, doesn't mean that when you want to go and get the healthcare in the hospital, they'll tell you, oh, do you pay tax? Where's your tax social number? Where's your this one? No. If you like pay tax, if you like don't pay tax, all they ask you when you get to the hospital is your documents. I didn't bring my own with me, it's downstairs. Your documents, your like a card. It's like a book, like a leaflet. So you open, when they open it, they'll just write whatever injection or whatever they treated you for on the book. I'm going to add a picture to this video too. I forgot to bring it. Oh my god. But it's in the other video with Sister Anu. It's with the other video where she was holding it, the blue one. Yes, so it's in the other video. Or if you guys can pause, let me go and get it. I'm back. So this is my SUS card. This is what it looks like. I'm in Rio de Janeiro, so this is Rio Prefeitura. This is what it looks like. Okay, so a card, what they wrote here is like let me translate it to English. Adult vaccine card. So it's caderneta de vacina do adulto. So it's like adult vaccine card. So when I came newly to Brazil and they took me to the hospital to go and register for it, immediately when I stepped in, they gave me hepatitis B, gave me tetanus, gave me actually they gave me 3 injections that day. So either is that hepatitis B, either they gave me 2 types of it. I don't know, I can't remember. But I know I got hepatitis B vaccine. I got tetanus vaccine. I think I got yellow fever vaccine because I was coming from Africa. Can't remember, but I got like 3 or 4 that same day. On my 2 arms, I cried like goats. Then I couldn't get vaccine the same day, COVID-19 vaccine the same day, because it wasn't wise for health. Like, it might be too much after taking 4, and then you take one more extra COVID-19 vax. It might be too much. So, anyways, let's not divert. So this is the card you get when you come to register for healthcare in Brazil. What was I saying before I brought this card? I was telling you guys how all you needed to show was this card, and then you just state whatever it is you're there for, and you get treated. I asked Dr. Tosin the other day that what are the beneficiaries? Like, who are the beneficiaries? Who enjoys these things? Is it just Brazilian citizens, or people that have permanent residency, or what, or who? Then I remember he said that everybody enjoys. I am saying he said that because I've made my research too. I know what it is. But maybe when you guys hear from doctor's mouth, or when I refer to a doctor that said it, you will believe me more. You can check on Google too. You can read online. So he said that everybody is a beneficiary. International student, investor, tourist safe. You just need to show this card or show your identity card to register to get this card. Tourist, even if you're not a tourist, Dr. Tosin gave us a story that yesterday that there was one time at the hospital, like they rushed an Australian woman to his hospital where he was working on the shift that day. They rushed an Australian patient to the hospital. She was like due for labor that day. And all they asked her for was her name and where she was from. And they went on and delivered her. They delivered her baby for her without collecting 5 naira, without asking her where is her permanent residency, where is her Iwe Igbelu, where is her, are you legal in this country or not? Oh, nothing like that. They just asked her for her name and where she was coming from, just for registration purposes. They gave birth, like she gave birth to a baby there for free. She was handed some baby care, pampers, feeder, clothing, even as she's not unprivileged though, socially unprivileged. Because I'm sure if you came from Australia, you were here on a visit. If you don't have like Brazilian document, you're probably here on a visit, or probably you were here just to give birth to on Brazilian soil so that you can have the citizenship. Ah, that baby is so lucky. So the baby has like Australian citizenship and Brazilian citizenship. Hi, what a life. Is well. Is well. We'll get there. So, anyways, they gave birth to the baby for her, and that was it. She did not pay anything. She left. I can't emphasize it. I can't emphasize more on Brazilian healthcare. You need to come and experience it to know what I'm speaking about. So we asked, how much does it cost for your healthcare? Like, tell us the truth now. Because these things are they're too good to be true. Tell us the truth, Dr. Tosin. Is it true that healthcare system in Brazil is truly free? I said it's free. You don't pay 5 naira. You don't pay $0. You don't pay nada. You don't pay shit. Hey, Chineke. You don't pay anything to enjoy the Brazilian public health care. You don't pay anything. If I remember earlier, I was trying to tell you that the healthcare in Brazil is divided into two: private sector, public sector. Public sector is funded by the government, and um, ironically, from the citizens too, through tax and donations. So private is private owned, like the name implied, private owned. It's for people that like Dr. Tosin that studied medicine, then decided to go and open a medical center or a clinic, an hospital. So privately owned, they will charge you. Obviously, they will charge you. So everybody, he said no. He said it costs nothing to go to enjoy private health. I mean, to enjoy public healthcare in Brazil. And I said, does it extend to some major health issues like cancer, kidney this one, diabetes that one, major surgery, even baby delivery? Does it extend to all these things? Lupus. It extends to everything. There's no limitation of disease here. There's no, okay, it's only for malaria. It's only for vaccination. It's only for no. It's for every disease in the world. And the funny thing about Brazilians is that they know that the government cares for them. Or I don't know if they don't know or if they know. But they to an extent, they know that they have like a public health care system waiting for them because how they eat sugar and salt. We don't eat their food. Only sometimes. I've only eaten their food once. And when I say their food, I don't mean the ones that we go out to restaurants to buy food and all those things. Not those ones. Like I mean all this local food that you order from Uber Eats or any app that delivers food. We don't really eat their food because if it's not too salty, it's too sugary. So you have to be very careful as an African when you get here. We always cook from home. Always. Whenever we're going anywhere. Like especially when my mom is going to our store in the morning, we would have woken up like around 5, 6. We'll cook from home, cook our regular rice and beans with stew, cook our plantain, yam and fried eggs. Because if you eat me, I feel like if you eat Brazilian food consistently, like you might have health issues. Me, I don't know, Sha. It depends on everybody. I don't know. I don't know, but in our tongue as Nigerians, it's too salty and it's too sweet. They like chocolate, they like hi, like salt. If you buy like churrasco, like beef, like suya, it's like suya. To be over salty, over it's nice, but I mean, maybe some people like it. Let me not even talk for Nigerians. Maybe some people like because they're Nigerians here that they eat that in here. Even pig, they eat pig a lot. So for myself and my family, we don't really engage in it. Just try our best to eat the ones that looks familiar. So it's like they know that this healthcare system works for them. So you know what they used to do? They used to eat all these sugar things. Eat a lot of sugar because when you catch diabetes, you be doctors wait for you. But after they will cut your leg and you still be alive. God forgive me. So Brazilians don't bother about stuff like that. The the free healthcare extends to all kind of diseases, extends to all kind of problems in the world. You just have to register early. The problem, okay, I'll go to that later. Register early and go frequently to the hospital to get a number so that you can reach your turn to enjoy this benefit. So he said, I asked about the life expectancy in Brazil. I don't want to spoil this card. About the life expectancies of Brazilians, they are, doctors said they are like 80-year-old for female and like 70 for male. And that one I attest to it because in my mom's store, I'll just sometimes when I go to my mom's, I'll just see them. I'll just like very elderly woman, very old. And there's even these twins, the two women, they're twins. They are old. You should be like in their 90s. They're very elderly. You see them, their nails are painted. They are fixed their nails. Okay, well, even me that I don't fix my nails the way they do. They fix their nails, different colors. They would come to front of my mom's store like this. Oi, amiga. Oi, minha filha. Tudo bem? Graças a Deus. So, nobody's holding them. They are holding themselves. They are always together, holding themselves. Like 90-year-old women, they've shrinked. Like, is it shrunk or shrink? They've like shrinked. They are now very tiny. And like their backs are bent, wrinkled face, and all those things. They hold themselves. Those ones, they're not even strong. There's one particular woman that comes to buy candle in my mom's store. That one, I'm sure she was a gangster when she was young. She would just stand at the entrance and hold cigar like this. Eu, minha filha, eu quero vela. And I'm looking at mommy, how is this woman? If this woman is not almost 100, it will remain small. And she's doing all these things. She'll be the one to go enter bus by herself. She'll stop the bus. Oh, you're on the bus. I'm like, God, please, oh. God, please, oh. Give us good health. As in, the woman is so agile, so beautiful. Like she dresses well, wears palazzo, wears short, like crop tops. And I'm like, healthcare must be really good in Brazil. Was really, 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 really good in Brazil. So, Sha, That aside, so that's life expectancy for Brazilians. What is okay? Some people were asking me that as a medical doctor, can I come to Brazil to practice like medical doctor in another country? Can I come to Brazil to practice? And I'm like, of course. Of course, Dr. Tosin answered it yesterday. All you need to do is to reevaluate your documents, your certification. You studied in Unilag medicine. You want to come and work in Brazil. Go to the embassy, evaluate your documents, your certificates. Go to the Ministry of Education in Abuja, evaluate your documents. Go to Ministry of there's one other ministry you're supposed to go to. I'm sure they will tell you when you get to the embassy. Reevaluate it. They are looking for doctors, medical practitioners. They're looking for you in Brazil. They are shortage, so you need to come and work in Brazil. There is shortage of them because I don't know. Many of them here don't like to study. Foreigners are the ones that come here to study. So if you're interested, go and reevaluate your documents. Go to the embassy, reevaluate your documents. Tell them you want to come to Brazil to work, and you are invited. They will give you all the details on what you need to do. I saw one pet doctor on my Instagram, and I was like, pet doctor. Do you know how much you'll be making here in Brazil? They love pets so much. Dentist, all those things. Come to Brazil, go to the embassy, revalidate your documents, apply for a visa, and come and work here, please. So somebody asked about sickle cell management. Sickle cell management, I think, is a thing that happens constantly only in Nigeria or Africa. It's not a very common thing here. Do you understand? It's like malaria. If you tell them you have malaria here, they will stripe you. It's like madness. It's like you have one mad HIV or disease. You get so you only time you have fever. So malaria is not a constant thing here. It's not sickle cell is not a constant thing here. But there are specialized places, but there are not as many or as common as other diseases. So sickle cell management, they will just if you meet a doctor, they'll just refer you to another doctor that will treat that will manage the sickle cell of your child. I'm wishing you good luck. So somebody asked that what's the requirement to study nursing in Brazil? The requirement is for you to apply through go through my videos, please. These YouTube videos, go through it. There's admission processes that I gave there. All you need to do is your NECO result, WAEC result, one of the two, not each of them. One of the two, apply application form, pay the application fee, apply to a school here, get admission, write self papers, and get your visa. Your visa comes from Brazil, not from Nigeria. So you can't tell me that after you've studied for self papers, you've passed the exam, they now deny you visa. No, visa comes from Brazil. Comes from Brazil. Nobody in Nigeria has authority to give you, not to give you, or to give. Visa comes from Brazil. So that's aside. I think this video is getting too long. This is my longest video. Wow. I hope you guys are able to watch it with the internet problem in Nigeria. Okay, so that's all for today. That's all for today. I've read all the questions out. We've learned in this video that Brazilian healthcare system is free. There is no limitation to who can benefit from it. You can give birth through CS. Yes, somebody asked if you can give birth through CS. Yes, you can. Can they manage sickle cell? Yes. Life expectancy, 80-year-old women, 70 men. How much does healthcare cost? It's totally free. Does it extend to critical conditions? Of course. And can you work here after you've already, like if you studied abroad, can you come and work in Brazil? Yes. So thank you guys for watching this video to the end. I'm so surprised. 22 minutes. Oh my god. Longest video I've ever made. Think it was worth it. You people need to know about health. We need to calm down and talk about health because it's a very crucial issue. So thank you guys for watching this video. Thank you for learning. If you have any more questions, kindly send to me. I am here for you to answer all your questions about Brazilian healthcare, Brazil in general, and all other things Brazil. Thank you guys for coming to my tube today. Love you. Happy Sunday. Ciao.